All right, well, welcome back. I'm going to go ahead and hand it right over to Colleen Harriman, who is a wonderful Covering Wisconsin employee. She is a regional lead navigator in our our South Central area, and has much experience with helping employees transitioning from employer coverage, especially with rapid response, which I know she will partially addressed in this session. So take it away, Colleen.
All right. Thank you, Allison. Welcome, everyone. Today, we are going to be talking about considerations when transitioning from employer coverage. Again, my name is Colleen Harriman, and I am a regional lead navigator with Covering Wisconsin. I'm very happy to introduce you to my co-presenter, Sue Lane. She is the Benefits Navigator Lead with the Family Health Center of Marshfield. And our guest speaker today is Jeff Westra, Business Services Manager of the Workforce Development Board of South Central Wisconsin. For today, our agenda is actually going to kick off with Jeff. He's going to give you an overview of rapid response teams in the state. Then we're going to focus on the role of the assister on rapid response teams. And following that, we're going to move on to discussion of coverage options, reviewing important deadlines, highlighting exceptions that could impact your consumer's coverage. And then finally, we will do a quick review of resources and save time at the end for your questions. All right, so it looks like we are working on bringing Jeff in. So we will just give him a moment to join us. I will. Okay. While we're waiting for Jeff to get ready, I just wanted to share that the rapid response presentations are really such a great way to reach consumers, and especially in a very tense part of their life. And it's a really nice collaborative experience because we have the United Way there, people from unemployment, WorkSmart, and of course, workforce development. And it's very efficient, and I think it's just a really great way to reach consumers. And after the presentation, then you can meet with those consumers and possibly set up further appointments. So it's really kind of a nice one-stop shop. All right, let's see. We're still waiting on Jeff. Let's see here. Why don't we try a polling question first? We'll start with our first one. Just to see, we'll do a little preview quiz. And Dana, I don't know if you're able to load that in. Oh, okay, I think Jeff is here.
Yeah, and the polling question has been loaded and looks like people are responding. I'll go ahead and read it. It says, how many days SEP does a consumer have to enroll in spouse or parents employer coverage? And so the SEP is special enrollment period. And so the two options are A or B, 60 days. And we'll give people maybe 15, maybe getting close to about just 10 seconds more to think about that, provide their answers, and then we can share the results.
Thank you, Allison.
And hopefully everybody can see those results. So most people responded. This was 63% said B, 60 days. And then 36% said A, 30 days. And And Colleen, you can think about whether you want to discuss that now or wait until later in the presentation to talk through just what the correct answer is and yeah, any other information about that.
I think we're going to table that for the moment, unless Sue feels differently. Okay. Jeff, are you ready to go?
I am. Can you hear me okay?
Yes, sounds good. All right. So I'm going to give the floor to Jeff and take it away.
Well, thank you. And I apologize about the technical issues. I don't know what happened there, but anyhow, my name is Jeff Westrom, the Business Services Manager with the Workforce Development Board, South Central Wisconsin. A little bit about me is I've got a bit of a non-traditional career path that ranges from my initial career in the hospitality industry for about 12 years. From there, I went into sales and sales management. Found my passion for helping others, and then I took a position as a director of career development with Herzing University, where I found another passion, which was workforce development and helping people achieve their career goals. So I've been the South Central Region Business Services Manager for the last 4.5 years, and I am the key contact for our rapid response team. So what is a rapid response? A rapid response is part of a federal program known by the acronym WIOA, which is the Workforce Innovation Opportunities Act. It's designed to provide workers that are affected by business closures or mass layoffs with services and resources that can help them to transition into new employment. Technically, we're charged with assisting any dislocated worker in our region, but the rapid response presentations in particular are done for those who are part of a work site in which 25 people or 25% of the company's workforce has been affected. Generally speaking, my peers and I find out about dislocation events through what's called a WARN notice. The Department of Workforce Development receives a letter from the company notifying them that they meet the criteria and the threshold that I just explained of 25 workers or more, or 25% or more. Then that is immediately shared with me and members of the workforce system. And then we reach out to the company and the Central Wisconsin Rapid Response Team. So next slide, please. So in the South Central region, there's 11 different workforce development boards throughout the state. Here in South Central, our rapid response team is comprised of the board, which is myself, the WorkSmart Network, which is our name for our WIOA program for dislocated workers. The State Department of Workforce Development Unemployment Insurance Division sends a representative from their team, the American Job Center Partners, covering Wisconsin, and then local and state workforce and economic development partners. In addition to providing information on unemployment and area resources, we can also, through our programs, assist with training, short-term training up to an associate degree for those who qualify, or upskilling, short-term trainings that help people become more layoff resistant. One of the key goals that we have, and where covering Wisconsin comes into play, is that no one should go without health insurance during their transition period. So it's highly valuable to us that we have covering Wisconsin as one of our key core partners. So my appreciation to the team for all that we've done to date. If you want to get connected to my peers throughout the state, you can contact me. I'd be more than happy to make that introduction. We have seen a significant amount of activity uptick this year. I think as part of that soft landing that we've heard about for so long by the Fed. And so sadly, we're seeing a lot more activity. But even more concerning is the number of companies that aren't filing WARN notices and are either just laying off short of the number that would be required, or just not filing, period, in which the downstroke for us is that we can't serve those participants or those that are affected and help them with the resources that they're entitled to in our region. So with that, any questions? Well, Colleen, I take silence to be consent.
And I don't see any questions in the Q&A so far. But yeah, definitely a moment to encourage everybody. If you do have questions throughout this presentation, feel free to just type them in, and then the presenters can get to them as they're ready.
Thank you, Allison. All right. If there are no other questions, we are going to go on. Sue is going to take us through the next part of the presentation.
Good morning, everyone. And thank you, Jeff. And just some background of myself. I worked for over 26 years with the Workforce Development Board in West Central Wisconsin. So that was where where my connection comes from. It's really important to have strong relationships with your Workforce Development Board, DWD, and your job center staff. And having that connection, for one thing, all year long, we get referrals from the staff at the job center of someone that they've met with that needs health insurance. And it's a nice warm handoff to come to us to help with that. The other thing is that, we having that relationship, we're invited to participate in the rapid response sessions, which is really helpful to those people that attend those sessions to hear all the information, including health insurance. An example of this was recently, earlier in this year, HSHS, which is a Hospital Sisters Health System, announced they were closing Sacred Heart Hospital and St. Joseph's Hospitals in the Eau Claire and Chippewa Falls area, along with 18 Prevea clinics. And that affected about 1,300 employees. And talk about stressful. That was a very stressful situation. Because we all have a good relationship with one another, we were able to get that rapid response session pulled together, and we were able to do on-site presentations at both hospitals and at several of the Prevea facilities as well, so that people could get that information. We also did a lot of follow-up sessions at the locations where people could come in and ask questions, maybe after they were done with their work shift or at lunch or what have you, so that we could be available as well. In addition, a number of job fairs were scheduled, and we attended those job fairs as well. One thing I wanted to tell you about that's probably not something you've heard a lot before, but the job centers or DWD have, I think, 3 mobile units that they have available throughout Wisconsin. So in many of the sessions that we offer now for rapid response sessions or those follow-up sessions afterwards, is we do a combination where the mobile unit from job service will come to a location, and they can help with resumes, cover letters, job search, planning for interviewing, whatever. But being able to, and then we come as navigators to those same locations. We've done it a lot at the libraries in local communities, and this kind of came out along with, because Prevea had clinics in many of those smaller communities. But now we're doing it on a regular basis. So we're scheduling these sessions with the mobile unit and with our navigators in some of these smaller communities throughout our whole general area. And it really helps for those people who are looking for that assistance to come to someone local and meet someone local. It's really, I guess I assumed that it was easy to walk into a job center or to walk into a place to meet with a navigator, but people will tell us how, nerve-wracking and stressful that is. So having that face-to-face interaction with people is really helpful. And in that relationship, we also create community partnerships too. So being able to partner with rapid response sessions, we're able to accomplish a number of things. One, we can put faces to the navigators, and it helps to ease their fears. We can share important dates ahead of time, hopefully, and so that they know when those different special enrollment periods end. and we can give them basic options for what they may be able to choose from for health coverage. Because let's face it, most people don't really know what's available to them outside of their employer coverage. I try to get the end dates before the rapid response sessions so we can give them those specific dates that they need for those SEPs. 30 days to enroll in a spouse's employer coverage after health insurance ends, 60 days for the marketplace, and 60 days for COBRA. COBRA is the only one that provides retroactive coverage back to the date that their coverage ended. Every employer has different options available. Some offer severance, some end the coverage the day that employment ends. They're all very different. So it's important for us to have as much information ahead of time as possible so that we can help those people make the decisions and know the critical dates that are necessary for them to enroll in other coverage. Consumers may be dealing with don't go back yet. We went ahead a little bit. Okay, there's a lot of stressors impacting our conversation. Consumers are going through a lot of stressful things. They're worried about money. They may have outstanding medical bills. They may have a lot of other things that they're dealing with, and we can help with those as well. Most people really have little knowledge about SEPs. Are we on slide 10? Yes. Most people have little knowledge about SEPs or other health insurance options. We explain that it's very individual for each person or family. And generally, most employers only, they may offer 2 or 3 options during their open enrollment session. So it's not quite as challenging to choose one of those options. But on healthcare.gov, there may be over 50 options in an area when they start looking at those the different levels of coverage and the different providers. We let them know that we'll meet with them on an individual basis so we can determine what their needs are, their medical needs, their what providers they may be interested in, prescriptions, upcoming surgeries, their current health conditions, and then we can go over what options may be available and what fits their new budget. Most people are actually relieved to learn that there's something, affordable and with reasonable coverage on the marketplace. And of course, in some cases, children may be eligible for Badger Care, where the parents may be eligible for a spouse's plan or something on the marketplace. If they have outstanding medical bills, we can reach out to the hospital or clinic's financial assistance program with that person, and we can determine if they're eligible. We can let them know that they may have some discounted bills due to the loss of their employment and a lower income. But most importantly, and Jeff talked about this a little bit too, we should explain how important it is now more than ever to maintain health coverage, as there are out-of-pocket maximums that protect people from having to pay, a lot of money for their medical bills. And even at the lowest level of coverage, the out-of-pocket maximum is a little less than $10,000 right now, which may seem like a lot for a person. But considering that an unexpected health event could cost tens of thousands or hundreds of thousands of dollars that individual could be responsible for, and they'd be responsible for 100% of that cost, it's really important that they have at least some coverage that will protect them from bills that they may never be able to pay off. I think we do our best, and we should be doing our best to help consumers find health coverage that meets both their needs and their income schedules. Okay, next slide, please. I often ask the attendees at the rapid response session a few questions. I look at the group, and then I may ask how many may be eligible for spouse coverage, if they have children in the family that need coverage, or if some people are looking at possibly early retirement. that helps me to kind of determine where my conversation will go and what the focus of my presentation will be that day, and then go from there. I think it's also important to share a scenario or two if you can, depending on what the needs of the group are. If they say there are a number of people that are interested in possibly going through early retirement, I'll share one of my experiences that I had with a woman who, after 20 years, lost her employment, and her husband is already retired, but she was covering the insurance. And she had about 5 more years before she turned 65. While we were talking, she expressed that she really didn't want to go back to work, that she wanted to spend time with her husband, since he's already retired. Well, we met together, and never once did I meet these people in person. It's always been over the telephone, but we still developed a good relationship with one another and a trusting relationship. They were able to find coverage, and albeit it was they each had a plan at a different provider. And at that time, it was $0 a month. They were just ecstatic to be able to find out they were able to retire. So if that's kind of the group, that would be a scenario I would share. Otherwise, share an appropriate scenario. I think it's really helpful to be able to do that because it personalizes it a little bit more too. And the other thing is, had they not, and this was a referral from the job center, by the way, had they not received that referral, they probably never even would have considered her retiring, and she probably would have gone and found a job, been unhappy at that job, and worked another 5 years. So we do change people's lives. Another thing that I do for our rapid response sessions is I create a 1-page document, and I highlight those critical dates on there. So if I know when their health insurance coverage ends, I will put those dates in there so they know exactly when 30 days will be that they have to enroll in their spouse's coverage, or the 60 days that they'll have to enroll in employer coverage, or going back to COBRA. These dates come up quickly, and this is why I really stress how important the dates are, because we all know how fast time goes by, and 30 days can slip by pretty quickly. And if they miss those dates, then they're kind of out of luck for a lot of assistance. So 30 days for employers, that was one of the things that we were talking about that the poll question was for. So it's really, really important that remember that 30 days is all they have to enroll in the spouse's coverage. Oftentimes, too, it may be less than that, because if they want to have coverage that continues, they may lose their coverage in the middle of the month. And as you know, generally speaking, new coverage starts the beginning of a month. They may only have a couple weeks to enroll in that spousal coverage in order to have ongoing coverage. I include our navigator information, both our phone number and our email address. I also include the Covering Wisconsin information. I have WIS covered information in there. And I sometimes will list a number of health insurance agencies in the area that are qualified to help with Marketplace. I also include a step-by-step process of how to use the window shopping tool on healthcare.gov. It's a quite easy tool to use, but people kind of need to see it or visualize that before they're willing to do it. And I also give them a warning about just doing a Google search to find a health insurance marketplace, because if you choose the wrong, you click on the wrong place and enter your name and phone number, they will get phone calls on and on and on from agents that probably are going to offer them coverage that isn't qualified coverage in our area, and it may be very costly. Lastly, I list the names of the companies that are offering plans on the marketplace in that area. That gives them a little assurance that they recognize the names of those companies, that they'll be able to find coverage that meets their needs. So keep your presentation short, use plain language in real life scenarios, including, again, I included healthcare.gov plans. If we know that we're going to have individuals that speak another language, or a number of individuals will provide information in their language. And then after we end that session, we always tell them that we're going to stick around for a while and talk to people individually, and then schedule appointments, for another appointment. Okay. Health insurance options. This sheet is so helpful, and we always have those in the packets as well. It gives a really good rundown of the different options that are available to people, and how to determine which one works best for them. And they're available in English and Spanish. Next slide, please. Okay, and again, we're going to go over this just quickly. Health insurance from a job. Does a spouse or parent have a job-based plan offered? There's that 30-day special enrollment plan. And find out if the health insurance from the job is considered affordable for all family members. This form here is really, really helpful to help determine if that's the case or not. And sometimes we actually do find that it would be more reasonable for those family members to go on a marketplace plan rather than everyone go on the job-based plan. Because as we have seen ourselves, those family plans continue to go up and up year after year. Next slide, please. When do young adults age out of a parent's plan? Typically, young adults can keep their parents' employer coverage until age 26 or through age 25. Find out the exact date because it varies by employer, and look at the premiums, the out-of-pocket costs. Look over what that coverage is, because they may find a plan is more affordable and has better coverage on the health insurance marketplace. The exception to this is for young adults that are on Badger Care or Medicaid. They age out of that parent's case when they turn 19, and at that point they must go on their own. Next slide, please. Oh, whoops, not next slide, sorry. TRICARE, young adults can be, this is for armed forces family members. If they are on TRICARE, they age out at 21 unless they're a full-time student. And if that's the case, they may stay on until age 23. And of course, healthcare.gov, young adults must be claimed as a dependent to be on their parents' plan, or they can apply on their own. Only one tax filer per healthcare.gov application, though. It all goes by tax filers. Now, next page, please. Again, Marketplace is a personalized shopping experience based on the consumer's income, needs, and the county they live in. This means coverage costs may vary greatly from coworkers. And that's why I always tell people, don't listen to what your neighbor said or someone else said about how expensive it was, because you really need to see what the plans are for you, and that you may find, very likely may find something very affordable. And then I share examples or samples. Next slide, please. This is an example for a family of 4 with $85,000 a year income. This is just, a general showing one scenario where there may be many, many scenarios that people can see when they look on the marketplace. But in this one, that shows that the children are eligible for Badger Care. A lot of people think that if they make that kind of money, that their kids wouldn't be eligible for Badger Care, but they very well may be. The parents have an advanced tax credit of $1,020 a month towards their premium. And in this situation, there were 4 different companies that they could choose from. Now, another thing that I wanted to talk about this is with the window shopping tool, you can filter, and it's really, really a helpful tool to use. Even I learned how to filter. You can filter by the plan that you're interested in, the deductible, covered doctors and facilities, whether you want bronze, silver, or gold, what prescriptions you have. It's really important, especially if people have prescriptions that are not in that generic range, and they're on they're a higher cost medication, because sometimes they're not offered in those plans. And then you can also filter for HSA eligible plans. Okay, going back, I believe, to the next slide. Okay, and this is our last one. And we did the poll question for this one already. That was the one we were going to do. So I don't know if we're going to do a different one or not, but this is my last slide. And I didn't really want to go into a lot of the explanation of the employer health reimbursement arrangement, the HRAs, and how they affect healthcare.gov, because it is pretty complicated. But I did do a Google search for that. And I found lots of really good resources out there on the different options that are available. But just a little synopsis is that HRAs are account-based health plans that employers offer to reimburse employees for medical expenses. Employers may offer either an individual coverage HRA or an ICRA, or a qualified small employer HRA. And I'm not even going to try to figure out how to say that. I think that you'll see this is going to happen more with smaller employers, because I think it offers some really good options. But you just want to be very careful to make sure that if they have this offered, what type it is and whether it affects their ability to do anything on healthcare.gov. A pro tip is to use the healthcare.gov decision guide to prevent the consumer paying more or owing money at tax time. And the link is included here on this slide. Are there any questions?
And I don't see any questions in the Q&A as of yet.
Okay.
Yeah, it doesn't mean that. I think sometimes people are still processing. It's a lot of really excellent information that you shared. And thanks also for going back over that poll question that we shared at the very beginning. So if I understand correctly, the correct answer was 30 days. Is that right?
That is correct.
All right. And I think most people actually answered 60 days. Now, of course, that was before you had shared your presentation, but I think, yeah, it shows how complex this can be.
Well, and I think it makes it even more complicated, because they may be thinking of if people lose Medicaid, then they have a 60-day period to get into spouse's plan. But in most cases, it's only a 30-day period. And I would guess that about 99% of people do not realize that they have such a short time frame to enroll in a spouse's plan. And I can't tell you how many people I've talked to that missed it by a day or 2 days. And there's just no exception to it, unfortunately. Thank you.
All right. Thank you, Sue. All right. So now we're going to turn our attention to COBRA. COBRA is the federal legislation allowing employees, spouses, former spouses, and dependent children to continue their current employer's health coverage after a qualifying event, such as termination of employment, a reduction in work hours, retirement, or bankruptcy of a private sector employer. These eligible folks have a 60-day window to enroll in their COBRA coverage, and they can enroll retroactively. Please note that their dependents, the spouse or the children are eligible for COBRA, even if the former employee themselves chooses not to sign up for COBRA. If you have a consumer who decides to take sort of a wait and see approach, knowing they can enroll in COBRA retroactively, as an assister, it's important for us to make sure we help them not only evaluate coverage options going forward, but those enrollment deadlines so that they don't miss that window. And a case in point is the employer coverage through either a spouse, or if someone is under 26, through their parent. They only have those 30 days. For most people, there are more affordable health insurance options than COBRA, as employees are typically asked to pay the full cost for the premium, and the employer may add a 2% administrative fee. If an employer is contributing and paying for a consumer's COBRA premiums, here again, we need to make sure the consumer has all the information they need to have a plan going forward. So again, question number one is, when will that employer contribution stop? And then going forward, what options work for that person or that family, and what are those enrollment deadlines? And sometimes COBRA actually can be the most effective option, despite the higher premium. Your tip off here is if the consumer or their family, if they have met their out-of-pocket max on their employer plan for the year. In this situation, I still find it useful to go ahead and run the numbers. So calculate what the consumer will spend in COBRA premiums for the balance of the year, and compare that to what they may have to spend if they choose a new plan on healthcare.gov with its premiums and out-of-pocket costs. Bear with me. All right. So the length of time someone can be covered by COBRA can vary depending on the circumstances. For most people, 18 months of coverage is typical. And again, it's following that qualifying life event of reduction in work hours, termination of employment, retirement. However, for the spouse or dependent child of the covered employee, there are a few life events that would actually extend their COBRA coverage for a full 36 months. These events can include the death of the covered employee, cases of divorce or legal separation, or if that covered employee is entitled to Medicare. Finally, there is the possibility of an 11-month extension for a total of 29 months of COBRA coverage in certain circumstances for a disabled individual and their non-disabled family members. This part of the law is quite complex. The CMS page that I was reviewing on this didn't get into a lot of detail. Their strongest recommendation is, if you have someone in this circumstance and you have questions, to please direct them to the CMS email address you see on this slide. All right, so what about those HRAs? Can employers reimburse COBRA premiums through the HRA? And the answer is yes, sometimes. If the plan was set up that way, if the HRA was designed to allow for the reimbursement of COBRA premiums, then yes, those funds can be used. The safest thing here, because there are many different types of HRA setups, is to confirm this directly with the plan administrator. Other news, health savings accounts, HSA funds, can also be used for COBRA premiums. However, flexible spending accounts, FSAs, cannot be used for COBRA premiums. But if someone does have money in their FSA and they elect COBRA, they continue to have access, so they're not forfeiting any accumulated funds before they end up becoming eligible for COBRA. All right, so can consumers change from the marketplace, from COBRA to the marketplace? And again, sometimes is the answer here. So if a consumer or their dependent elect COBRA, they may qualify for a second special enrollment period, which allows them that pathway to choose other coverage. The qualifying events here are marriage, adoption or birth of a child. Of course, if they've exhausted their COBRA, if they've been on it for the full 18 months or 36 months, they can easily change to a new plan. And also in the case of marketplace enrollment, if the family household income drops to 150% or below the federal poverty level, that is, again, another pathway to move to safely cancel COBRA early and move over to the marketplace or other coverage. This great little chart is available on healthcare.gov. And we're going to take a look at scenario A for a moment here. Steve was receiving COBRA and his employer was helping him pay for his COBRA premiums. Once the employer contributions ended, Steve could no longer afford his COBRA. So does this give him an opportunity to find other coverage? Can he safely cancel his COBRA early? And the answer is yes. And it's also true whether it's open enrollment or outside of open enrollment for healthcare.gov. Additionally, if you have a family who comes to you, or a couple like Pam and Joe in scenario B, and they've been on COBRA and it is now open enrollment for the marketplace, again, this is a very easy thing. There's no risk in canceling their COBRA. Outside of these circumstances, typically canceling COBRA is not going to give the consumer a qualifying life event for a special enrollment period, particularly for employer-sponsored coverage, either through a spouse or their parent. All right, now we're going to turn our attention to the Veterans Administration. They have a number of different healthcare programs for veterans and families of veterans. Thanks to the signing of the PACT Act in August of 2022, the VA healthcare coverage eligibility was expanded. It's now open to all veterans who meet basic service and discharge requirements. And it's been expanded to include those veterans who were exposed to toxins and other hazards while serving our country both at home and abroad. The VA is now encouraging all veterans to apply. For the families of veterans, there's a number of different programs. Some of them you may be familiar with, like TRICARE or CHAMPVA. There's also the PCA-FC, which is more focused on those family caregivers who are either veterans themselves or the family members of a veteran. If you're working with a consumer or their family and they're not quite sure what they're eligible for through the VA, I strongly recommend you to help them contact their county Veterans Service Office to learn more. This is a great resource, and they can also identify the other programs outside of health coverage that those families may be eligible for. All right, we're going to touch on Medicare a little bit. As you know, Medicare is typically for those over 65 or consumers who have been receiving Social Security Disability Income, SSDI, for at least 2 years. It is also open to those consumers with a diagnosis of end-stage renal disease or ALS. Now, for those folks who are on COBRA or considering COBRA and they are Medicare eligible, there's a few things to know. Medicare eligible consumers have 8 months after their job ends or after losing that employer sponsored coverage, so whichever happens first, to enroll in Medicare, even if they elect COBRA. After this 8-month window, the next time they can sign up for Medicare is going to be the following January 1st through March 31st. And at this moment, that means their Medicare will begin the month after they sign up. So if you have a consumer who enrolls in Medicare in January, that means their coverage is not starting until February. So the key thing here to know is that to make sure the consumer understands that delayed enrollment can cause a gap in coverage, and possibly result in a lifetime Part B late enrollment penalty for the consumer. Again, as assisters, we're not licensed in the Medicare counseling piece, so always refer to our friends at the State Health Insurance Assistance Program to get further guidance. Also, your local ADRC, Aging and Disability Resource Center, is a great place if your consumer is trying to figure out Medicare options. All right, so sometimes our consumers come to us and they have heard about other options for coverage. And one of those is short-term plans, short-term limited duration insurance. These look kind of perfect on paper to someone who has just lost their job and are, you know, haven't figured out their next option, because they're set up for brief gaps in coverage and they can get coverage for up to 4 months. The other program that they may be aware of is something called a healthcare sharing ministry. These are defined as a group of folks who share common ethical or religious beliefs, and that same group shares their medical expenses among the members in accordance with those beliefs. And the problem with both of these options is that neither option is subject to the protections of the Affordable Care Act regulations. And so the danger here to your consumer is that neither option has a requirement to cover your consumer's pre-existing conditions or essential health benefits, or to cap out-of-pocket costs. Additionally, claims can be denied and your consumer's coverage can actually be terminated, leaving them with a mountain of medical debt. For those families who have a mixed immigration status, there are a lot of different moving parts here. There are regulations and programs to know. And instead of trying to cram all the necessary information into a few slides here, I'm going to invite you to please join the Covering Wisconsin webinar on immigrant coverage eligibility. It's going to be held on Tuesday, October 15th from 1 to 2:30. It's going to include an overview of new policies such as the premium tax credit eligibility for residents with DACA status. It's also going to cover the other health coverage program eligibility for immigrants and mixed status families. The registration will be coming soon through the Covering Wisconsin email listserv. All right, for this last bit of the presentation, I'm going to just do a quick review of resources that are available for both you and your consumers. Thanks to the partners that make up the Wisconsin Collaboration on Immigrants and Public Benefits, this texting tool can help those immigrants concerned if using public benefits or signing up for health insurance could impact their immigration status. This is a simple tool to use, it is fast, and it is confidential. This is just one resource found on the Collaboration's webpage for immigrants and public benefits. This resource page is housed on the Covering Wisconsin website, and I encourage you to take a look. There are other things that would be useful for your families of mixed immigration status. Other resources available as you're working with your consumers are, sometimes it's nice to have a quick screening tool so you have a visual aid as you're working with the consumer. And there's one specific for Medicaid eligibility that is found on the Access website. That address is access.wisconsin.gov. The tool is called Am I Eligible? Pretty clear. There's also a very quick 2-question coverage option tool on Covering Wisconsin's website. And this is kind of nice because it just tells them, okay, yes, based on what you've shared, sounds like you're a Badger Care possibility, or maybe help through healthcare.gov. Additionally, the Covering website, the Covering Wisconsin website, we also have our web chat feature. So they can, after using this screening tool, pop right over and talk to a navigator to maybe get further directions or set up a time to have an appointment. All right. Our educational resources are available again on the Covering Wisconsin website, and they're available in English and Spanish. They cover a wide range of topics under several headings. So there's a number of sheets on different facets about using healthcare.gov. Same for Medicaid and Badger Care programs. There are also consumer-specific help sheets like how to choose a plan, how to choose a plan when you have a chronic condition, how to prepare for your doctor visit. Additionally, there's a budget worksheet. And sometimes that's really helpful because so many consumers come to us, especially if their life is in a bit of chaos, and they haven't had a chance to even figure out how much they can afford to spend on healthcare a month. All right. Oh, and additionally, there are resources by county and resources for caregivers. And then for our assister-specific resources, we have outreach and promotional toolkits. There is material ready for you for the next open enrollment. The great news here is it's available in Spanish, Hmong, and English. We also offer online trainings. And again, there is information about those regional enrollment networks. So you can partner with other people doing this work in your area to ensure that you are reaching all your residents. All right. Does anyone have any questions? And thank you so much for your attention today. I really appreciate it.
There are definitely questions in the Q&A. You, and I know Elena or Dana will put you and Sue back on the main stage, and you can take a look at those. And maybe while we're doing that, we'll also post the final poll question.
Oh, thank you.
Yeah, no problem. And so I'm going to go ahead and do that, and I'll do this last one. How many days to enroll in COBRA? Is that the one we wanted? Otherwise, we'll just let people answer, and you guys can give some explanation. And we'll give people, another 45 seconds on that. But yeah, while we're the end, so just so everybody knows, the answers are either A, 30 days, or B, 90 days. And so people are still responding to that. And then Colleen, and so you can kind of take a look at the Q&A. If you click on that live Q&A button at the bottom of your screen, you'll see some of the questions that have come in. And we have about, 6 minutes left in the session. So we'll see how many of those we can get through. Maybe just 10 more seconds on this poll question. Then we'll end it and share the results. All right. So we had 52% say A, 30 days, and 47% say B, 90 days. So kind of split.
You know what? And that's the wrong answer. Oh my Lord.
Well, good. Maybe that's good that people are realizing like, I'm not sure.
I am so sorry. It's 60 days. And I cannot believe I missed that. So much for my English degree. My apologies to every single attendee here. You can enroll in COBRA up to 60 days, and you can enroll in it retroactively. Holy cow. That was a big miss. My apologies.
Good job, attendees, for being split.
Yes.
Because you all realized it was actually in the middle, and that's why you split. So good job. 60 days, everybody. 60 days.
Yeah, 60 days. So sorry. Hopefully we can.
All right. So we have, about 4 minutes. Why don't you guys take a look at the Q&A and go ahead and read whichever questions you want to try to address in these final minutes.
Okay. Do you want to take the first one, Sue, or what would you like to do?
I'm just looking at it now. You go ahead and choose one, I guess. I'm looking at them right now. This is the first chance I even knew.
Oh, that's okay. So I'll start with the earlier one. So it says, if someone quits or is fired, are they still eligible for COBRA? So when I was reading about COBRA, if they're fired, unless it's for gross misconduct, which I don't know how to define that, but it must be pretty darn serious, other than, you know, typical, maybe not doing a great job. So unless it's something truly egregious, like they, I don't know, threatened a coworker, they should be eligible for COBRA if it's for an employer size that's 20 or more employees. Okay, so then I'll just go ahead to the question. The next question says, I missed the exception for the 36-month COBRA coverage. It did not list being on Medicare as one of the exceptions. If the what am I trying to say? Let's see here, eligibility for yes, if the covered employee is eligible for Medicare, it could give their former spouse, independents the additional 18 months of coverage. Okay, next question says, does someone with end-stage renal disease also have to meet the non-medical criteria for Medicare, meaning they have to have enough work orders and have paid into the system? I will have to get back to you on that question. I don't know. My understanding was simply having that diagnosis, it qualifies them for Medicare, but that I will have to look into that for you. I don't know. All right. There's one from Mike Rust at 1038. Do you want to take that one?
I can't. I don't. Yeah, read it to me if you want. I don't.
Okay, I don't want to. Okay. It says, I recently worked with a consumer who had taken a very expensive COBRA option. We determined that a marketplace plan would cost her less, even at full price. We applied online and she was given APTCs. We were shocked at this and called the Assister direct line to confirm her receipt of APTCs, even though she was dropping COBRA early and outside of OE. Did the affordability algorithm take over here? I don't understand it otherwise. What am I missing? So do you want to go ahead and take that one?
No, I don't.
Okay. So based on the healthcare.gov chart, and we were talking about our friend Steve, who his employer was contributing to COBRA and then stopped, and then Steve could not afford his COBRA premiums. My takeaway is that it is that affordability piece. And if someone has other information they want to share, please feel free to pop it in there. Let's see. I don't want to go over time.
Yeah, maybe take one more, and then I think the rest
Okay.
of the questions we'll just have to take back. And often in years past, what we've done is just posted responses as part of the session on our website.
Okay. Let's see here. Oh, sorry, they're all loading. Sorry, slightly unrelated to this presentation, but will the MTM handout on the CW website be translated in Spanish? Yes, we can have that happen.
Great.
I actually thought it was.
Yeah, it may already be or in process. I know that's the one that needed to be updated recently. So it's possible that the Spanish language version is coming if it's not up there yet. But yeah, I want to thank you, Colleen and Sue and Jeff, so much for this excellent presentation. So much information. Definitely lots of questions. And like I said, we'll take those back, and Colleen and Sue, I think, let's see if we can get those responded to, and we'll post those on our webpage for the conference related next to this session. All right. Excellent. Thank you so much, everybody. And so we'll take a quick break, 10 minutes. We'll be back here at 11 o'clock not here. So, right, go back into the platform. Our day, we'll close it out with representatives from a few QHPs and sharing out some information about their plans for the year to come. All right, see you in a bit. Bye.